Welcome, welcome, welcome. This is Dr. Hassan, board certified physiatrist and independent practice owner, coming live here for the book launch. I want to thank everyone for tuning in today. This is the big reveal. Dr. Janine, thank you for tuning in. Huge moment, huge moment. This is kind of what we've been building up to. I want to thank some very special people. I want to start with thanking the Almighty for just waking me up every day, pushing me forward, and just giving me the opportunity to be around good people. I want to sincerely thank Dr. Dre for giving me the opportunity to be a part of the Medical Mogul program, be a part of the Medical Mogul community. I want to thank the Medical Moguls alum as well as my classmates for all the support and the motivation. You guys push me every day with the amazing things you guys are doing on a daily basis in terms of just helping people, but also getting out there and pushing the boundaries of what they think physicians can do. Dr. Philandy, thank you for joining in. I want to thank my mom and my dad. My dad definitely for just showing me work ethic every day, pushing me. Hey, Dr. Barb, thank you for joining in. Pushing me to be the best, stressing education, and just kind of being a role model in terms of just me seeing what he does on a daily basis, waking up, going out there, taking care of the family. Dr. Stephanie, thank you for joining in. I want to thank my mom because she is my heart and soul. She is the best parts of me. When you see my compassion, that's her living through me. So I definitely want to thank my mom. Dr. Mashika, thank you for joining in. Dr. Ken, thank you for joining in. Gotta thank my sister, my big sister, for just supporting me and taking care of her baby brother. It's so many people that I want to thank. My family and friends. I want to thank my residency program, one, for accepting me, because that was a huge part of me being here today, because Dr. Carla, thank you for joining in, because they took a chance on me. One of the big themes I would say in my life is people taking a chance on me and just giving me the opportunity. That's the one thing. Just give me the opportunity, I'll do the rest. So I definitely have to thank Mary and Joy for that. Who else? There's so many people. I'll get back to thanking people, I guess. So we are here today to celebrate the launch of my book, Profitable Practice, a 90-day kickstart plan for physiatrists. How that came into existence is just kind of listening to people, co-residents, and other people who are kind of in practice, and just listening to some of the pain points and things that they really did not enjoy about inpatient medicine. And when I really kind of sat down and thought about what they were saying, what it was really about was they were working really hard and not necessarily getting reimbursed for the amount of hard work that they put into it. And thankfully, like I said before, Dr. Lindy, thank you for joining in. Like I said, with my residency program, it was kind of a hybrid academic / private practice program. And in that, the attendings taught us how to be physiatrists from an academic standpoint, but they also taught us the business of medicine. What they would do is they would go out, or they would come in early in the morning, we would round together, and then they would leave and do different things. That could be, they would have an outpatient practice where they did injections, they would have a consult service, they would have an orthotic clinic, a prosthetic clinic, but they would do all these different things, which kind of laid the blueprint for what I'm doing now, and what I'm trying to teach other physiatrists and physicians to do is basically get out there independently, do what you do in terms of taking great care of patients, but also be able to benefit from that from a monetary standpoint. One of the big things I want to do is hand medicine back to physicians. Right now, you have a lot of physicians who are in, certain positions, be that employed versus maybe a hybrid employment position type model, and they're not necessarily happy because they're working really hard, but they're not seeing the fruits of their labor. So what I want to do is, or what I've done with this book is created a resource so that they can do very similar to what I did coming straight out of residency, setting up their private independent practice and just kind of hit the ground running and kind of give them financial independence and freedom. Freedom to go out there, pay off his student loans, start a family. Dr. Sabine, thank you for joining in. Get a house, do all these adult type things that we kind of defer when we embark upon the path of medicine. Medicine is a huge sacrifice for all of us in terms of all the things that we kind of delay. It's huge in terms of delayed gratification. So what I wanted to do is equip us, with the ability to be able to go out there and immediately start hitting your highest earning potential, so that you can do, hey, Dr. Sylvia, thank you for joining in, so that you can do these different things so that in turn you're happy. And if you think about it, a happy physician equals happy patients. Because if you enjoy waking up, going into work, then you're really going to be locked in and dialed in when you're treating the patients, seeing the patients, coming up with differential diagnoses and helping people get better. One of the big things that I like about rehab is, Dr. Sam, thank you for joining in. One of the big things I like about rehab is you actually can see the transformation in terms of patients going into the acute rehab and being completely dependent. They can't get up, they can't walk. Some of these patients can't talk, but after their time or through their time with us, they become more independent. Now they're talking better, they're walking better, they're able to get up and down to the toilet. All these different things that we take for granted because we do it every day. But after some type of acute event, when they go into the hospital, they can't do that anymore. So that's why I love rehab. And, I want other rehab docs. Dr. Dietrich, thank you for joining in. I want other rehab docs to kind of feel that so that they can be happy, and that will translate into better patients. Another reason why this is kind of near and dear to my heart is my father had 3 strokes before he passed away. And that took a big toll on him. Growing up, he was a man, he was a go-getter. And seeing him after he had the stroke, it completely devastated him, and in turn devastated me. And it kind of put me into a position where I, by default, had to become the man of the house. So it's really important to me to make sure that we're taking care of this patient population and helping them get better. So when I hear rehab docs talk about how they don't like inpatient medicine and, there's a shortage of physicians on the inpatient side, that hurts me because they're stroke patients, spinal cord injury patients, all these patients who are potentially not going to get access to physicians who can help them get better. So I kind of took the responsibility and onus to try and create a resource for physicians who are already in practice, physicians who are kind of coming out of practice, residents, and this can even expand, eventually down the road to other physicians. So, just super excited, super happy to be a part of this community. Dr. Dre giving me the opportunity. Passion equals purpose. So, just going out there and trying to do the best that I can. Some of the topics that we cover in the book are billing companies. I kind of talked about this on one of my previous Facebook Lives, but billing companies are going to be hugely important to you because they control the money, So if you have a very strong billing company, that can help you increase your revenue. You also want a billing company that's pretty savvy in terms of going after tertiary, secondary insurances, because they're going to get that primary insurance, but you want them to go and try and get reimbursement from the tertiary as well as secondary insurances as well. It's going to be hugely important to understand how to bill and code correctly and how to document that. Dr. Charlotte has a great program in terms of that I've taken, and I recommend to other physicians as well. But that's going to be an important piece. That was a key component to my residency program, is we had an individual by the name of Monoxy. So before we started our pain management program, we had to sit down with her and go over that. I know there are a couple questions about the link to purchase the book. I put it in the Facebook post, so if you could check that and see. If not, if somebody can throw that link in there, that would be awesome. It is, let me look at it, bit.ly/Dr. Hassan 2020. Hopefully that helped out. So she went through how to appropriately and accurately document so that you can capture the different codes that you need when you're billing. And that was hugely important because when I came out, I was basically able to start out and hit the ground running and be able to bill, which kind of helped in terms of making sure that I was capturing everything I did from a work standpoint, because I was working pretty hard. So let's see. Other things that we can, hey, Dr. Monica, thank you for tuning in. Just a huge accomplishment. Hugely thankful and grateful for the opportunity to be here and kind of put the message out and potentially help other physicians, which is great, I think. I know I don't think I could really say that I ever thought that I could call myself an author. But again, being a part of this family, being a part of this community, Dr. Dre puts you in a position to be able to do this. So I am eternally grateful for him, and hopefully other physiatrists, as they pick up this resource and read this book, they will be grateful as well, and be able to really understand what this means. Absolutely, I'll go get a copy of yours as well. I'm just trying to think about some of the other things that are important. We have inpatient rehab medicine. A lot of people don't necessarily understand what we do and how we help patients. So that's another aspect of being able to go out there and talk about what we do. Part of my story, I told you a little bit of that, was how when my father had his stroke, after his second stroke, actually, they actually recommended that he go to a skilled nursing facility. This was back in Chicago. I knew the outcome data and how that was not the most appropriate level of care for him. So thankfully I was in a position, because of kind of all the things that I learned before, to be able to say, no, he's not gonna go to a skilled nursing facility. We're gonna bring him out here to Arizona and really take care of him in an acute rehab setting. So that was a huge accomplishment that I was able to make, being able to do that for my father and take care of him. Being able to take care of student loans, being able to pay off my student loans has been a huge accomplishment. That building and creating a profitable practice has been able to put me in a position to do that as well. So that's one of the things that I want other physicians to understand, that they can do that if you do it the right way. We talked about in the book how to set up your practice in terms of efficiencies. One of the big things that I hear from Dr. Charlotte, thank you for joining in. One of the things that I hear from other physicians is they don't have medicine coverage. So I covered this in one of my previous Facebook live posts, is that what you can do is you can bring your own hospitalist, right? So if you set up your profitable practice, what you can do is bring on hospitalists as independent contractors. And what you also do is you explain to them how to bill and code, and then now you create this win-win where they have incentive to go out there, take great care of patients, but also in taking care of great patients, they actually benefit that from a revenue standpoint, as opposed to having to worry about RVUs and different things like that. Like now they keep, depending on what the agreement is with you, it could be anywhere from 85 to 90% of their revenue minus the cost of billing. So that's hugely important because, hey, Dr. Leslie, thank you for joining in. You really have to understand the ins and outs. Hey, Dr. Erica, thank you for joining in. You really have to understand the ins and outs of the business of medicine. That's one of the big things that they don't teach you in residency is how to be and run a business, because each and every one of us is the business. When you wake up, the business is waking up. When you go to bed, the business is going to bed. So you have to educate yourself. We educate ourselves on how to take care of these patients, but now we have to educate ourselves on how to, once we take care of these patients, take care of ourselves. Concept that I hear or see a lot is it seems as though as physicians, healers, caregivers, care providers, when you are prosperous, people look at you in a negative manner. So I want that to stop. We sacrifice so much to get to the point where we are. We should never have to feel bad about being successful from a revenue standpoint. Because we're going to take care of these patients, we're going to save lives, we're going to help patients get better, but we should never be demonized or made to feel bad because we're successful. Especially if you really understand business and you can do well from a monetary standpoint, there's nothing wrong with that. So don't let anyone tell you otherwise. Because I know where I practice, they talk about cardiologists, they want to do this, they want to do that. Listen, if they understand business and they know how to do business well, that's perfectly fine because they're also taking care of patients. And I think part of that is just envy, and you're going to see that. And, Dr. Dre kind of preaches that as well. When you're a healer, the devil will act upon you. So that's another thing I want to stress is, do not allow other people to make you feel bad because you're good at what you do and you can really hone in and be productive from a revenue standpoint. That's what nobody does that to Apple. Nobody does that to Amazon. Nobody does that to JP Morgan Chase. So don't allow them to do that to you. Make sure, because one of the things that we have to do as physicians is take care of ourselves. That's mentally, physically, and financially, right? We got to take care of all those pillars so that when we wake up, we go out there and we're living in our purpose and helping individuals, we are good and at peace. And part of that peace is from a financial standpoint. We financially have to be in a position where we're not worried about, where the next paycheck is coming from. Will I be able to pay off my student loans in X amount of time? Will I be able to make that car payment? Will I be able to pay my health insurance? We don't want to do that. We want to go to work, take care of patients, benefit from it, and create a win-win and be happy. I'm trying to see what are some of the other things. In terms of efficiencies of practice, I think it's hugely important to find a very good way to do your documentation. Everybody has to document. No matter what you do or what area of practice or medicine you're in, you have to document. So finding ways to efficiently document is another area that I talk about in the book. And you can do that by, hey, Dr. Jada, thank you for joining in. One of the things that you can do is hire a scribe. So in rehab medicine, we kind of have a particular niche where we focus primarily on sleep, pain, bowels and bladder, and just therapy in general. So if you go in there in a focused manner and you get the information on these 4 points, you want to train your scribe on how to translate that in the medical record. And you also want to try and set up your medical record in such a way that you have the documentation so that when you're doing that visit and you put that visit in the chart, you're capturing the complexity of that visit, so that when that claim is submitted to the billing company, you again can capture that high revenue. So efficiencies of practice, scribes is gonna be one thing. You also wanna come up with different templates, especially if you're dictating. A lot of things that we do are very similar. You're always gonna have your history and physical. You're gonna have your past medical history. You're always gonna have your surgical history, allergies, social history. For us rehab docs, it's a little more nuanced in terms of the social history, because we always have to come up with the picture of how that patient was doing prior to coming into the hospital, and who's going to be able to kind of help them as they transition home. So making sure that you kind of have a pretty slick template to kind of capture all that information is going to be beneficial as well. So we talked about scribes, we talked about the templates for your documentation. You also want to set up a system for billing. So some of the things that I do when I do my encounters is I print out my census sheet, and on my census sheet, so I reserve the right-hand side of the census sheet for my billing codes, and then there's a little space in between patients that I use to capture my subjective. And then what I do is I send that to someone who kind of knows my shorthand for what level I need to bill, and that system kind of helps cut down on time as well. I'm trying to think of other ways that you can be efficient in terms of taking care of the patients, documenting and submitting your claims. Another thing with your billing company is you want to make sure that, especially in these days and times, everybody's going paperless. You want a billing company that will be and help you or allow you to be as virtual as possible. So you want to have the ability to go to Iowa or Alaska or the Dominican Republic, Brazil, the Caribbean, and still be able to transmit your billing and also check your billing to kind of see where the revenue is. Because that's going to be important, because you want to know what's going on with the money, because that helps you plan. So having a billing company that allows you to be virtual and paperless is going to be hugely important as well. So that's another key point that I touch upon in the book. Everybody kind of knows about getting your medical licensure, although some states are a little different. Some states have tests that you have to take. So you want to do a little bit of research and do a little research beforehand when you're thinking about the different states that you want to practice in, because they may have some extra requirements that you have to take before you can kind of get your licensure. Finances. Finances is going to be important in terms of coming up with a good financial team. So your financial team is going to be hugely important. So exactly, Dr. Erica, Texas and that jurisprudence exam. I think Nevada has one as well. But yeah, so you want to make sure that you have a very good financial team that's going to put you in a position to be successful. So that comes in the form of your financial planner as well as your accountant. So your financial planner, financial advisor can help you in terms of setting up a retirement plan. So that's going to be another big thing that's going to be important for you, is planning for the future. So you've built this profitable practice, you're generating Thank you, Dr. Sylvia, for your support. I really appreciate it. You're generating this global empire. You're making all this revenue. You want to make sure that you, your family, and your family's family is taken care of. So you want to be able to put away as much revenue as possible for that future. And having a good financial planner, tax accountant is going to help you in terms of being able to really max out your retirement plan. Because depending on how it's set up, you may have the ability of putting $250,000 away every single year for a finite period of time, which is going to be hugely important in terms of being able to make sure that in the future you're taken care of. So we talk about that in the book, how to develop and build a really strong financial team that's going to help out in terms of that. Dr. Michelle, thank you for joining in. What else did we talk about in this wonderful book and resource that we have created? We talked about insurance. Insurance is going to be important because everybody has to have insurance. That comes in the form of medical, vehicle, home, malpractice. One of the easy ways to do that is kind of a one-stop shop. So this is one of the things that my accountant kind of helped me with, was putting me in contact with an insurance broker. So basically you have one person who kind of is able to put you into or put you in contact with different people that can help you get the insurance products that you need. Like we talked about, car insurance, health insurance, home insurance, all these different products that you're going to need to, again, protect yourself and also some of your assets, because you are the business. So you definitely want to protect the business. You want to have a good legal team in terms of protecting your assets, but also a good healthcare attorney who's going to really review your contracts and make sure that you have good contracts. I know Dr. Bonnie has a wonderful class beyond the exam room where she talks about contracts, so definitely check her out. But having a good legal team to take care of you in that standpoint is going to be hugely important. We talk about that and go over that in the book as well. Other things that we talk about. We talked about the billing company. We talked about efficiencies of practice. The different practice settings. I think that's hugely important because as physiatrists, sometimes we may not understand that there are multiple areas that we can practice in and be able to have an impact on patients. So in my particular practice, I'm in as many different practice settings as possible. Everything for me kind of starts with the acute care hospital. So you have that healthy patient who, before everything happened, was independent, driving, doing everything on their own, and then they had some type of health event. After that health event, they go into the acute care hospital. What I like to do and what I want to do and how I want to make my impact is going into the acute care hospital and basically doing a consult. So when you do that consult, you assess the patient and you figure out now where they go. That can be acute rehab, that could be subacute or skilled nursing, that could be LTAC, that could be home health, that could be outpatient, or that can be just back home with no services whatsoever. But it's gonna be really important to be able to transition that patient into the post-acute care continuum. That's what we do. We are the specialists who handle and deal with the post-acute care continuum. And yes, Dr. Stephanie, I do consults. Oh, absolutely, in the ICU. So I see my patients with ICU myopathy, ICU critical illness, polyneuropathy, critical illness myopathy, sepsis encephalopathy. Absolutely, we see those patients, and those patients are definitely ideal to get to acute rehab. And that's why you need a physiatrist there in that acute care. Oh, Dr. Dia, thank you for joining in. I appreciate you. That's why it's hugely important to have us physiatrists in the hospital because sometimes you got to think about it. Your loved one's future outcome is based on sometimes a therapist. And that's no knock on the therapist. They go to school, they're trained very well, but you want to make sure that that outcome is going to be based on a physician making a determination of what's the most appropriate thing for them. So that's why it's important to have that physiatrist in that hospital so that they can do that and serve that purpose. What else? Dr. Mashika, thank you for your support. I really appreciate that. I'm trying to think of what else. Okay. So in the different practice settings, you want to make sure that you have a physiatrist there. Because if you're talking about rehab, you want to make sure that you have a rehab doctor overseeing this rehab program. I know sometimes when we send patients home with home health, there's not really a lot of physician oversight. So these patients are home, they're going through a rehab program, but no one's kind of overseeing how they're doing, if they're progressing, and if they're making functional gains. To me, that doesn't really make a whole lot of sense. So I want to make sure that you have a physiatrist kind of in that area, helping to get that patient better and get that patient back home. So that's important for us to be in the home health setting. It's important for us to be in the skilled nursing setting because you could potentially transition that patient to acute rehab from skilled nursing as they start to improve. So I think sometimes folks get a little confused and think that, well, once you go to one practice setting, you're just kind of stuck there and you can't transition. But that's not the case. You can have a physiatrist in there assessing a patient, assessing a case to kind of figure out what's the most appropriate plan of care and really effectively transition them. So practice setting is going to be important. That's one of the other things that we talk about in the book, is figuring out your practice setting and seeing how you can impact patients in that way as well. Let's see, what else do we have here? I think it's a great resource. I know there's a huge need out there. Some of the larger rehab providers, absolutely. We do get cardiac patients. Dr. Dia, I love my cardiac patients. At one of the big referring acute care hospitals, we take TAVRs, we take post-CABG patients, we take our CHF exacerbation patients, we take our vascular patients. So we definitely make sure that we service the cardiac patients because they have a huge need for rehab and to kind of get back, because a lot of times, as you already know, they're very deconditioned. They have poor endurance, and we can help them from a rehab standpoint with that. And a lot of times, I think a missed point of a patient having a heart attack and subsequently undergoing that CABG is there's a psychological component. We see that in rehab when these patients transition through us. And what I do and what we like to do is get neuropsych involved because there is a component of fear of dying. They kind of sometimes realize that, hey, I am a mortal and I almost didn't make it. So you want to provide them with services to help them deal with that. So we definitely get neuropsych involved with those. Thank you, Dr. Erica, for your support. I appreciate that. We want to make sure that we get neuropsych involved to kind of help that patient population. And then once they're finished with acute rehab, we transition them to outpatient cardiac rehab. So we definitely try and do a good job with those cardiac patients. And then, we really want to focus on different service lines. If you think about it, each and every service line has a patient population that could benefit from rehab. What I like to do when I go into the acute care hospital is really focus on a particular service line. So with the neurologist, you want to focus on definitely the stroke patients, MS patients, Parkinson's patients, and depending on the season, you can have GBS patients, transverse myelitis, are huge diagnoses that you look out for. In terms of your neurosurgery patients and populations, you have your traumatic and non-traumatic brain injury, your traumatic and non-traumatic spinal cord injury patients. Dr. Celeste, thank you for joining in. So those are patients that you can really look out for and be able to service when they come through the acute care hospital. When you're talking about trauma service, you have those patients who are involved in both blunt as well as penetrating trauma, especially if it's multi-trauma or multiple trauma. Those patients will definitely benefit from acute rehab. Previous post, I talk about leveraging the research. Research does show that outcomes are better when patients who have had multiple trauma transition to acute rehab versus other post-acute levels of care. So that's going to be hugely important to really hone in on the different diagnoses. So if you're talking about the nephrology service, you can capture, thank you Dr. Celeste for your support, I really appreciate that. You can really capture uremic myopathy. I think that's a diagnosis that goes without being able to have the access to acute rehab services, is those nephrology dialysis patients who develop uremic myopathy. Metabolic encephalopathy, those patients, Dr. Monica, thank you again. I appreciate your support as well. Those encephalopathic patients, they come in with metabolic encephalopathy. These are your patients who most of the time are middle-aged and, paying their bills and driving and working, and now they have this confusion that they can't fully get back to independence. So these are patients who would benefit from transitioning as well. Big component is being able to go out there and advocate and educate the people in the acute care hospital. That's going to come in the form of your case managers, your therapists, even the physicians. So if you think about it, where I am currently in Arizona, out west, there may be, let's say, 5 residency programs out on this side of the country. And as a result, a lot of physicians don't get a chance or opportunity to interact with physiatrists. So they really don't understand what we do. So a lot of times there's a misconception that, we just do injections. And that's not all that we can do, especially in the acute care hospital. We can really have a huge impact by seeing patients and being able to effectively transition them to a different level of care. So you want to make sure that you get out there and you educate other folks about what we do and how we can help them. So that's a huge component of advocacy that I like to talk about and do when I'm in the acute care hospital. Let's see, what else do we talk about in our wonderful resource of this book? Diagnoses in general, leveraging research is going to be huge, as we talked about before. And just really understanding that as this need exists, and it's going to become more prevalent because folks are having strokes at a younger age. So if you think about it, you're having younger individuals who now have functional deficits who want to get back to their prior level of function, and you're going to need someone to kind of help them with that. So in terms of, Dr. Philandy, thank you for the question. In terms of some of the injections that physiatrists can do, they can do cervical, thoracic, lumbar, epidural injections. They can do ablations for pain management. We can put in baclofen pumps and manage those pumps. We can do a lot of regenerative medicine as well. So PRP is one of the big things that the field is kind of moving toward being able to do. We can do injections of joints under and utilizing ultrasound and fluoroscopy. So we can do a little different things such as that. A lot of times that does require extra training in terms of a fellowship, but those are some of the things that we can do as well. I'm trying to see some of the other things. Thank you, Dr. Charlotte. I think we're super docs. Some of the other things, yes, prolotherapy. You read my mind. That's one of the other things that I was thinking about. I couldn't get that off my tongue, but thank you for the assist. I appreciate that. Trying to think of some of the other things that we talk about in the book. I just think it's a huge resource. I'm very thankful for the opportunity to be able to put it out. I'm really hopeful that people will utilize it and find their way to it. Just look through it, read it, and then come back and so that we can have a discussion about it. Because it's huge. It's going to be huge in terms of putting you in a position to take more ownership of your financial life, which I think is hugely important from a medical standpoint. What's my favorite thing about being a physiatrist? Really, is seeing that patient who comes in completely independent walk out that building. And also just seeing their transformation in terms of realizing that they're able to get back to doing what they were doing before, regaining that independence. Is this a step-by-step guide? I think it is. So when I sat down to write the book, I thought about my experience coming out and what resource I would have liked to have so that I can just go straight from residency into practicing and do well and be successful. So I think it's kind of a step-by-step guide in terms of all the key components that you're going to need to be able to successfully go from residency into practice independently. And like I said before, the focus right now is physiatry because I am a physiatrist, but I think any physician in practice will be able to utilize it. And I think you can add other resources to kind of augment, such as what Dr. Charlotte does with her coaching program, her book, and her resources. Again, like I said, I use it myself, and I think it's amazing. So it's all these different layers and components that you can utilize to really be effective, efficient, and really do well. I think it would be very helpful for non-physiatrists as well. Because I talked about on one of my previous Facebook Lives is understanding the Medicare fee schedule. That's something that we talk about in the book, and that's going to be huge. Yes, PM&R is the same thing as physiatry. Physical medicine and rehab or physiatrist. It's our way of throwing people off. But yeah, so going to the Medicare fee schedule and really taking a look at the big E&M codes, CPT codes that you use on a daily basis and figuring out what Medicare reimburses for that particular service. And then once you figure out that dollar amount, what you do is you take 80% of that, and that's how much you could potentially be making. Now, that's not even taking into account that remaining 20% that, like I talked about before with that billing company. If you have a really good billing company who kind of goes for that secondary insurance, tertiary insurance, they may be able to capture that, remaining 20%, which is kind of like a bonus, So I recommend all the docs go out there, get a list of your top 5 to 10 E&M CPT codes, and basically go to the Medicare fee schedule and see what Medicare reimburses for that in your particular area. And now you have a better idea of what you're potentially making on a daily basis. So for, regular consult H&P, I believe Medicare pays out about $200. You take 80% of that. Let's say you see 5 to 10 consults on a daily basis. You do the math. That's how much you're kind of generating. And again, that's not taking into consideration the remaining 20% that your billing company could potentially capture. Exactly, Dr. Leslie. You don't want to leave anything on the table. For what? Why? You're only hurting yourself. You're doing the work. You're taking care of the patients. You're helping them get better. You should benefit from that. And again, it goes back to that concept of not allowing people to make you feel bad because you're successful at your job of healing patients. There's no reason whatsoever for you to feel bad for doing well and being good at what you do. So everybody needs to remember that. and not allow anyone to make you feel bad about, being successful at what you do and understanding business. They don't do it to Tim Cook, Jeff Bezos, these investment bankers, lawyers. I feel like in the medical field, we're kind of one of the only ones where if you're successful from a monetary standpoint, people try to put you in a negative light. So I want to make sure that you guys don't take that on. That's their stuff. That's not your stuff. I would have used another word, but we're keeping it PC right now. So it's a huge opportunity to put the practice of medicine back into the hands of the people who are actually doing it and making the biggest impact. It's kind of strange to see individuals who aren't really working on the ground level, taking care of patients, making 6 to 7 figures. You have these CEOs of insurance companies and hospitals who are doing very well, but they're not putting their licenses on the line. A lot of times in acute rehab, what I see, or as a physiatrist in an acute care hospital, I'll go in, see a patient sit at the bedside, talk to the patient, talk to the family, go through the medical record, look at the comorbid medical conditions, look at the labs, see how their comorbid medical conditions are impacting their current function and the potential pitfalls or morbidities that can occur with this patient. I make a recommendation, and someone from an insurance company comes back and says, no, they can go to a lower level of care, or no, I won't approve that. Now, that's based on not touching the patient, not seeing the patient, but they're now making medical decisions. And don't let anyone else tell you otherwise. They're making medical decisions without even seeing a patient. And everybody knows in residency, when you're on call, the first thing they tell you is, or ask you is, did you see the patient? So if you haven't seen a patient, but you're making these medical decisions, I think that's pretty scary, and that's not something that I want to do. But these are things that are occurring. Another thing I hear or see is patients who don't really understand medicine say, oh, I have great insurance. Oh, okay, all right, that's cool. But is your insurance going to authorize the level of care that you need and that's appropriate for you if it's so great? So again, we have to be out there. We're on the front lines. We're doing all these things, and there's no reason that we should not be adequately compensated for what we do, because we have such a huge impact on people's lives. So I want to put medicine back into the hands of the physicians and providers so that they can be happy and do an even better job with their patients, because happy doc equals happy patients is the new equation that I've come up with. So yeah, those are definitely things that I put in the book to kind of help empower physicians so that they can create, grow, and build their profitable practice, because it's something that's very near and dear to my heart, because we need it. As patients mature, I like to call them mature adults. As these patients mature, they need somebody to look out for them. So that's our job to do, and I take a lot of pride in it, and I try and make sure that every patient who comes my way gets better. I definitely think the book can help someone who has an established practice grow, because now they become more savvy and more efficient in what they do. So again, it's looking at their top 5 to 10 CPT and E&M codes, figuring out how much they get reimbursed, making sure that they have the documentation done in a correct and adequate way so that they can capture that revenue, figuring out ways to document these encounters more efficiently so that they can get more time back. and that time they can use to be with their family or hobbies or just self-care in general. So absolutely, I think folks who have an established practice can benefit from the book as well, because, you know, every day you want to learn more, and anytime you can learn something, it's going to make you better. And I think having the book as a resource is going to help you get better, make your practice more efficient as well. So I definitely think there's an opportunity for physicians throughout the spectrum of their practices, from the beginning till, you know, up until retirement. Because even if you're close to retirement, you know, you may be able to find ways to be more efficient at what you do so that you can have more time to yourself, but also be able to generate as much revenue as you wind down as possible. So I definitely think there's an opportunity in that also. Yeah, so I'm trying to think if there's anything else or any other questions. Hey, Dr. Lisa, thank you for joining in. I know you killed it today with your interview with the hospital system today, so congratulations on that, and thank you for coming in and showing support. Any other questions? How does it feel writing a book? Man, awesome. It's awesome. So title of the book is Profitable Practice, a 90-day kickstart plan for physiatrists. It's an amazing feeling. I don't think I really understand the gravity of it. Well, that's maybe not true. Quick story, funny story. And that's another thing. I forgot the physical copy of the book, but I had my physical copy. Thank you. I had my physical copy of the book, and I gave it to my mom. So, you know, she's actually, anyway. So I gave it to my mom, and she took it and just kind of put it down. She didn't really know what it was. So I said, hey, Ma. I picked the book back up and I gave it to her. And then she flips out. Like, because my mom's a huge reader. So she flips out. And then, you know, she kind of starts to cry a little bit and says how proud she is and how she wishes my dad was here to see it. So I think that kind of helped me understand the gravity of it. So yes, it's huge. It's amazing what we have been able to do with the assistance and guidance of Dr. Dre and his medical mogul community and family. It's amazing. I said it before. The man is a genius, and what he's doing is going to have a huge impact on this world. So you know, I'm thankful for the opportunity. It's been great. Can a new resident also find the book helpful? Absolutely. I've been in communication with a couple kind of folks who are fresh out of residency who are saying, man, this is great. You know, this is exactly what I've been looking for. It's something that I need to kind of help me, guide me in what I'm doing and help me be more efficient at what I'm doing. So yeah, it's great. Thank you. I hope he is looking down, smiling on me. How can docs contact you after this? So a couple different ways, but one way is to follow me on Facebook at Dr. Hassan Rehab, DrHassan Rehab, and we can kind of start the conversation there. Where can people find me online? Again, you can find me online on start with Facebook. You can also go to other social media platforms such as Twitter and Instagram. The handle should be the same, at Dr. Hassan Rehab, DrHassan Rehab. Thank you for the plug, for reminding me to do that. I appreciate that. Yeah, so it's great. You know, please go out. I know you guys have supported me because you're wonderful. But yeah, for those of you all who are also joining in or who see this on replay, please, you know, do a watch party for any individuals who you think may benefit from this information. and go out, buy the book. You know, just get the book, get the resource, look at it, you know, and see how it pertains to what you do or what you can learn from it to help you get better. I guarantee there's at least one thing in that book that will help every physician, at least one thing. And that one thing could help you double, triple, quadruple your revenue. So even for that reason alone, I think it's worth going out, getting the book, checking it out, so that you can help yourself. Yeah, people should share, tag, post, repost, everything and anything you can do it. You know, get the information out there to everyone and anyone, so that they can get better and really benefit from the hard work that they put in, from the time that they started medical school to the time they finished residency, up until now, you know, practicing medicine. You know, it's a great resource. Everyone could benefit from it. So go out there and get it. You know, I wrote it for that reason. You know, it's my way of kind of giving back to physicians to empower them to take back medicine. You know, take back medicine. We work hard, so we should benefit from the hard work that we put in. You know, sometimes 12, 16-hour days, you know, everyone else thinks, hey, Dr. Vanessa, thank you for tuning in. You know, and again, don't allow anyone to make you feel bad for being prosperous. You know, you put in a lot of work, a lot of time and effort, and you do an amazing thing in terms of taking care of patients. So make sure you go out there and you benefit from that. You know, learn how to be as good as you can at what you do, not only from a medical standpoint, but also a business standpoint, because you are the business, and learning and knowing the business is going to be important. So I definitely encourage everyone to go out there and pick up this book, this resource, so that they can get better. You know, get better and get more efficient at what you do and how you practice. Anything else? Any other further questions? Well, if not, I thank everybody for joining in, for their support, for listening to me ramble for almost an hour. I didn't think I was going to be able to do it, but I did, so I'm excited about that as well. So yeah, you know, go out there, get it, you know, spread the word, encourage other physicians to go out there and get it, get the resource, take a look at it. I guarantee there's at least one thing in there that will help you better at your practice, help you be better and help you generate more revenue. I guarantee it. I guarantee it. So please go out there and do yourself a service. Buy yourself a gift. This book will be a gift to you and a gift to your practice and a gift to your pocketbook. So the name of the book again is Profitable Practice, a 90-day kickstart plan for physiatrists. But it can be for any doctor. But we're focusing on physiatrists, but it can be any doctor. It can be any doctor. Go out there and get it. It's going to help you build your practice, grow your practice. Thank you, Dr. Janine. Thank you, Dr. Monica. I'm going to tell you guys a story later on on everything leading up to this, but I'm just thankful that you know, I had the opportunity to get in front of you guys and talk about it, and just the opportunity to be here and write the book. And I'm excited about 2020. I'm excited about the future. I'm excited about all the medical moguls in my class and all the wonderful things we're going to do. Thank you, Dr. Leslie. So hopefully I set a pretty decent tone, and you guys are going to pick up on that and take it to the next level. So I'm excited to see you guys' launches. And, you know, MMA 20 is going to set the curve. So thank you again. I'm so very appreciative. Profitable Practice, a 90-day kickstart plan for physiatrists. Please go get it. You can get an autographed copy at www.profitablelearning.com. profitablepracticeplan.com. You can get the ebook now on Amazon. Go out, get 6 copies, 10 copies, 12 copies. Ebook is a little cheaper, so you can get a couple of those. Autograph copy, not that bad in terms of price point, in terms of how much more money it can make you. It can make you a lot of money. So go out there, get it, help you get better at your practice. I appreciate the support. Look forward to 2020 and interacting with everybody and helping everybody. So this has been great. I think I'm gonna wrap it up. I am Dr. Hassan, board certified physiatrist and independent practice owner, helping physiatrists start and grow their profitable practice so that they can achieve financial independence and live without